Brandeis was a Supreme Court justice, and he said he was opposed to a lot of federal programs because we have 50 states. And he said, rather than make a mistake nationally, make a mistake locally so at least fewer people are harmed. And if so, there's a good idea, then we can bring it nationally. So the experiment has been done in Massachusetts, and here's the results. Remember, their goals were universal insurance. As it stands now, there's arguments about this number. It could be as low as 2% or as high as 5 to 6%, depending upon how you read, of how many people are still uninsured. They started with an uninsurance rate of Massachusetts of 10%. Costs in Massachusetts, they've instituted this big program. Remember, they keep telling you, if we just get universal coverage, it's going to be peace, love, and harmony, and all the costs are going to fall, no problem. Well, the costs in Massachusetts are rising faster than national averages. The people that put the program together said that they anticipated costs rising, and one thing they would do was come up with creative ways to make things more affordable by deregulating a few things, giving people more choices, more opportunities. The actual opposite has been occurring in Massachusetts, in that regulations and bureaucracy are limiting consumer choices and raising costs. Next, they had their cost projections. And of course, they're wrong, because they're about 25% over what they anticipated in just 2 years. Now imagine if that goes out 10 years, what that amplifies to. So now all sorts of things are happening in Massachusetts. They're talking about caps on insurance premiums. They're talking about cuts in provider reimbursements. They're talking about even what's known as a global budget, meaning, okay, we're going to spend $100, and whatever we get for that 100 is what we get, and then we're done. Anybody needs anything after that, we just quit. Actually, a lot of countries have that have solely government-controlled systems. Global budgets would exist in places like Canada and Great Britain. And the last thing is that because they did add a few people into the pool without really making it more attractive and providing more doctors to cover the program, there's increase in waiting times for services to see a physician. Okay, so as I said, took effect July 1st, 2007. One of their big keys was the mandatory individual health insurance. The employers could provide insurance or pay a $295 fee. They created something called Commonwealth Care, which is the arm to provide subsidies for the low income. But they defined low income as 300% of the poverty level. So in Massachusetts, you got subsidies if you were a family of 4 with an annual income of $66,000. They established the Commonwealth Connector, which is in the national bill, it's known as the insurance exchange. This was supposed to be the big marketplace. They bring people and insurance companies together so that people could buy insurance in a bit of a protected environment where things were controlled. Part of the reason to do that is every proposal I see keeps wanting to link your health insurance to your employer. And I'm here to tell you that's the dumbest thing we've done in the last 50 years, is link your health insurance to your employer. Because the first thing that happens when you get really sick is you can't work. Right. And if your insurance is linked to your employer by these rigid laws, you're stuck. And a lot of times, there's just no way around that. And they have COBRA coverage. Well, what COBRA coverage is it's showing you the true amount of money that's being paid on your behalf to the insurance companies. So the money's there, you just don't realize how much is there that you could be controlling. And of course, their big insurance exchange is only sold 18,000 policies in the last 2 years. So basically, this idea of getting people away from their employers so they could control the policy hasn't worked. And then the last thing, of course, was their goal was universal coverage. But they're talking about insurance coverage. And everyone knows insurance, just because you have a slip of paper that says you have insurance, that does not equal medical care. Just ask anyone from Canada or Great Britain, because that's what it does. It creates insurance, but it does not create medical care. And that actually is a Supreme Court case in Quebec, Canada, where a man sued because he had been waiting for 2 years to get a hip replacement, and the Supreme Court ruled that access to a waiting list is not access to medical care. What did Massachusetts prove? Number one, as we said, it did not achieve universal coverage. What it did do, though, is, interestingly, the number of people who said they had foregone medical care because they couldn't get to a doctor went up. Went from 3.5% in 2007 to 4.8% in 2009. It was even lower, worse for those in low-income categories, went from 4.2% to 6.9%. The wait to see an internist in Massachusetts has jumped from 33 days to 52 days. And of course, their next move, part of it mentioned above, is because they're having budget problems, they want to cut payments to doctors. Well, if they keep cutting the price that you pay for a product while overhead keeps going up, eventually you just say, I can't do it, I have to quit. And then there's just fewer and fewer available. You know, if you're a 60-year-old physician, you're getting near the end of your career, they keep putting all these rules in, and you're not making anything anyway, you just say, fine, I can't do this anymore. And then you're out of the pool, and now you've got even fewer doctors to provide the medical care. Once again, it has not controlled the costs. Here's, in Massachusetts, a policy for a family of 4 costs $16,897 a year. The national average is $12,700. As I mentioned, the state budget's 25% over their projections in just 2 years. They thought that if they added, the reason they created the insurance mandate is more faulty economic thinking. They thought if they mandated that all the young, healthy people buy insurance, that the price would come down because it would spread the risk. The reality is it didn't. The price keeps going up anywhere. The other interesting thing was they always thought ER visits would go down. Well, if we have mandatory insurance and everyone's insured, ER visits will go down. Well, that didn't work either because ER visits continue to climb. And actually, if you come to the Rockford Memorial ER, you'll find the vast majority of people that come to the ER already have either Medicaid, Medicare, or private insurance. It's not this, quote, place of last resort for the uninsured. There's any number of reasons why people use it from, you'll have doctors that their day is so tightly packed that if there is a serious problem, they just can't squeeze you in. And then they have to tell you to go to the ER. That's one aspect of things. Some people are just plain lazy. The idea of making an appointment and keeping it is beyond their ability to comprehend in this instant world we live in. And so they say, I don't want to make an appointment. I'll just go to the ER. Because guess what? There's a law called EMTALA. We have to see everyone who shows up. Can't turn them away. Once again, not severed the link between employment and insurance. Controls are increasing, and of course the budget's going out of control. The other thing is that that's not the only state that's experimented with this kind of a thing. Maine did it. It was called Dirigo Healthcare, and basically it was the same process. They implemented this, just about bankrupted the state. They had to cancel the program. Another one is Tennessee. TennCare is what that was called. Same process happened. They tried to provide universal coverage for all these folks. Prices went, the price of insurance just kept on skyrocketing. Costs kept skyrocketing. They had to cancel the program. And there's an example of really, really nasty government process, because they created this program and had hundreds of thousands of people in it, and then they realized it was going to go bankrupt. So now they've gotten these people into this arrangement from whatever arrangement they had before. They all got letters saying, I'm sorry, the program's canceled. You're on your own. So back to the theme of this talk, that there is no security in giving away your freedom. Okay? The only way to have security is to have control. And the way we run the system in this country is we send money to the government, we send money to the insurance companies. Both of those are known as third parties. They take the money and they decide what you're going to get. I see one group is always arguing about we don't want government control, and the other says, yeah, but we don't want insurance control. And I'm here to tell you, you don't want either one to control, because they're both bad in their own special ways. The only difference is usually if the insurance company says no, you can still probably get it if you're willing to pay for it. If the government says no, usually it's a crime to try to get it on your own.